Welcome to the WION podcast. Today we're doing a bit of a deep dive into something pretty surprising about body fat. It goes way beyond just, the waistline. You shared some really interesting stuff about, arm fat based on recent science.
That's right. Yeah, for ages, the whole conversation about health risks from fat, it's really been centered on abdominal fat, hasn't it?
Totally. Like watch your waist size for heart disease, diabetes.
Yeah,
That's the standard advice.
exactly. We've all heard that. But it seems there's more to it.
Okay, so let's unpack this then.
Yeah.
Because it sounds like arm fat, which I guess most of us just see as well. Arm fat.
Maybe a bit annoying, but not, a major health marker.
Yeah. But this new research suggests it might actually be an important signal.
It does seem that way. There was this pretty significant study recently. Scientists followed a huge group of people, over 400,000 in the UK, for about 9 years.
9 years. Whoa.
Yeah, a long time. And they looked at all sorts of things: waist, hip size, sure, but also fat mass, muscle mass, and crucially, arm circumference.
Okay, and I'm guessing the arm measurements threw up something unexpected.
That's putting it mildly. I mean, yes, they confirmed the known link extra tummy fat does increase the likelihood of things like Alzheimer's and Parkinson's by about 13%.
Right, okay, that fits the old model.
But then came the arm fat finding. It turns out individuals with more fat, specifically in their arms, showed an 18% higher risk of developing Parkinson's or Alzheimer's.
Whoa, wait. Higher than the tummy fat risk.
Higher risk for those conditions, yeah. And they were also more likely to have heart disease issues.
Okay, that's genuinely surprising. Just the fat on your arms. Why? Any ideas on the mechanism there?
Well, that's the big question they're exploring now. It could be related to systemic inflammation, perhaps, or maybe the type of fat stored in the arms behaves differently metabolically.
No.
Different fat depots release different signals, It's possible arm fat is indicating some broader issue.
Right, I see. And didn't the study also say something about flabby or muscly arms? That sounds a bit odd.
Yeah, that was another fascinating piece. They found that people whose arms fell into that description, maybe softer subcutaneous fat or more muscle definition, actually had a 26% lower chance of getting Parkinson's or Alzheimer's.
Lower. So it's not just any arm fat, but maybe the density of the muscle underneath.
It suggests that, yeah, it points towards composition being really key, not just the total amount of fat in that area. It might be more complex than we thought.
So this really does shift things. It's not just about the belly anymore.
Yeah, not entirely, it seems.
Where your body stores fat, even in your arms, could be telling us quite a lot about different health risks.
Exactly. It adds a whole new dimension, a more nuanced picture of body composition and long-term health.
Well, that's certainly food for thought. It's clear the whole body fat story is much more intricate than just focusing on one measurement. Really appreciate you breaking that down. Definitely gives you something new to consider about overall well-being. Stay tuned for more such intriguing stories to come on the WION podcast.